Good afternoon, everyone. Welcome to the 8th and last session of SOHO Saudi annual meeting. Today's session will focus on the integration of the AI and digital transformation into the healthcare system. Today we have two distinguished speakers. I'll start by introducing the first speaker, who is Dr. Dina Elsamman. Dr. Dina Elsamman is a consultant of pathology in Ain Shams, and she's currently acting as executive co-director of the AI. Dr. Dina is especially interested in the AI applications in clinical practice and the digital transformation process in medical sector. She has presented a number of talks in international conferences and workshops in the past 2 years, spreading awareness and education in the field. She's also working currently on a number of AI-based projects in her country. She is a passionate educator and the founder of personal online educational platform. Please welcome Dr. Dina. Dr. Dina, the floor is yours.
Thank you for the introduction. Good evening, everyone. It's my pleasure to be here. Firstly, I would love to extend my gratitude for the conference board and Dr. Riyad for the generous invitation, as well as extend my gratitude to the Kingdom of Saudi Arabia for fostering such an high-impact events, which reflects their interest and investment in a knowledge-driven future. Today, I'll be talking about AI in hematology as a practical introduction and roadmap for adoption. Firstly, I have no conflict of interest to declare. All the products and the tools will be for educational, non-commercial purposes. Okay, so to break the ice, let me ask you first, who uses any of these in the daily practice? Do you know these? Please raise your hand if you do. Oh, interesting. So do you use them in your regular daily life or in medical applications? Regular daily life? Both. Nice medical applications. Okay. Last thing to go. Do you think that the AI applications nowadays is a luxury or a necessity? If you think it's a luxury, please raise your hands. Okay. If you think it's a necessity, please raise. Okay, you made my mission today an easier one. Okay, so today's objective will go on a quick intro about the AI Center of Excellence and what we do. What is AI? How can I have an AI solution in my institute? The idea of the digital transformation as a fundamental for AI implementation. And last but mainly, the trendy AI applications in hematology. Okay, so where I come from in Cairo, Egypt, we have the AI Center in Ain Shams University. We actually work on 3 arms, which are the implementation in the hospitals and partnerships with the industry, supporting research, education, and training. Actually have a number of partnerships, and the credit of these go to my beautiful Professor Ayasin, the founder and the current director of the center. These are our partners currently. Okay, so what is AI in medicine community talking about these days? This is actually what I came today to tell you. Firstly, what is AI? The AI is the simulation of the human intelligence by machine. It's the idea that we are training computer machines to perform the normal tasks that a human brain can do, cognitive functions like learning, reasoning, and problem solving. The idea of trying to copy some of the natural intelligence function into a machine. What's really interesting and worldwide that is AI is estimated to contribute over $15 trillion to the world economy by the year 2030, and the greatest impact of AI will be in the field of healthcare. How is AI make medical practice easier? Starting from automation of tedious tasks, decreasing the workload, improving the workflow efficiency, providing better patient care, prioritizing and triaging urgent cases, enhancing reporting capabilities and diagnostic practices, improving thus the service quality and optimizing the workforce. Okay, now we got enthusiastic enough. So how can we have an AI solution in our institute? You have one of 2 choices. It's either you purchase an AI solution from online, you go to the internet and see all the available commercial solutions and pick the one that you need the most, or you develop an AI model in your institute by the help of the physicians together with the computer engineers, whether from the scratch or by the development of an already pre-trained model that needs adjustment and fine-tuning. Now let's see, what about the purchasing, the AI solutions? These are, for example, a number of commercial solutions that are already available online, some of which are interested or specific in imaging and diagnostics, maybe predictive analytics, hospital decision support, remote monitoring, drug discovery, more and more. Let me focus on the AI solutions in digital pathology, since I come from the digital pathology background and a pathology background. These are other examples for companies in radiology. Actually, radiology is the specialty that has been leading in the application of AI nowadays. But make sure before you choose the solution that you like the most or you need the most, that it's FDA cleared or CE cleared for clinical practice, because there are lots of solutions that are available for research use only. Okay, then the other choice that you can develop an AI model on your own. And how does this happen? This is an example from an AI model, for example, from pathology and bone marrow biopsies intertwined. What do? We bring the patient biopsy, and then we capture lots of images on the microscope. We transform them into digital images, and then we show them to the model or to the algorithm that we create, and make it learn as if it's a junior that we are teaching. In order to do this, you should have large data, or what they call mega data, or big data in your institute. I'm talking about thousands of cases, and maybe some bigger institutes or multi-institutional collaboration may provide like hundreds of thousands of cases. And again, when it comes to large data sets, we can go back to public data sets. There are open source data sets on the internet, or hospital genuine data sets. But the hospital genuine data sets are really the big thing, because it's always like hands-on clinical training versus textbooks. If we're talking about public data sets, they provide the variability, the demographic variability, the ethnicity, the everything that it has to go out with the real patient data. Then you go with the patient data through what we call a data pipeline. We do the data curation, the model development, and the model training, the algorithm, and we do the validation at the end of the day. And to make things simpler, I keep on saying the algorithm, we refer to the algorithm, or I can describe the algorithm as a recipe. The computer engineer just designs a number of steps for the machine to learn. For example, if I'm gonna teach it how to diagnose something on an X-ray, then I give those steps, load the image, analyze the image, point out the lesion, etc. Okay, so then what do I need in my institute to make AI work? Do I just purchase this solution or develop it and I have an AI? No, actually, you first need to do the digital transformation thing, and you should have hand in hand the digital archiving thing. The digital transformation is actually a whole ecosystem that includes infrastructure, hardware, and software. Going back and searching about the King Faisal Specialized Hospital, I've learned that they have been recognized as a smart hospital, so they have most probably been through most, if not all, what I'm going through. But assuming that we have people from across the kingdom, I'll go quickly through this. The digital transformation process actually includes, you should have a strong IT support unit, a high-speed network, hospital information system. Your hospital shouldn't be paper-based and you are planning to do AI implementation. You should have the hardware that supports this, like CT machines and MR machines that are PACS-oriented, like digital scanners that can transform the glass slides of the pathologists into images, high graphic processing unit, and all the equipment. You should have image management system, as I told you, because at the end of the day, AI is mainly concerned in the image-related sciences. Again, you need a security and privacy, because we're dealing with a protected patient information at the end of the day. An interoperability layer to connect all of these, and then you go for the AI solution and analyzes. But don't forget that you should have a vast space for storage and archiving, which might be a cloud or on-prem, according to your choice. But again, make sure if you choose a cloud space that it complies with medical data regulations to protect your sensitive patient data. Okay, now we come to the big part. What about the AI or the trendy AI solutions in hematology nowadays? We've been all hearing about AI applications in the myelodysplastic syndromes, in the acute myeloid leukemias, to diagnose blood cancers as a whole. So what's going on? Okay, that's a very nice article that I invite you all to visit, that it's questioning, is AI in hematological diagnostics a game changer or a gadget? And we will be exploring more about this now. In the field of hematology, AI has actually took many steps, including in the fields of the blood smears and bone marrow analysis, flow cytometry and data interpretation, genomic and molecular data, hematopathology, radiology and imaging, blood banking and transfusion, the research and drug developments, and the stem cell transplantation. But I chose today to explore 8 fields of these with you and show you some already examples that exist. Okay, so let's begin with the let's begin with the pathology, including morphology and immunohistochemistry. This is the example that I chose to show you since you are very interested in lymphomas. In this one, as you can see, that's a biopsy, tissue biopsy from a gastric, and this is a heat map that marks the area with the highest suspicion for lymphoma. Lymphoma, by the way, is always a challenging diagnosis for us as pathologists, especially if it's extranodal. So as you can see here, can I go back? Okay. In this one, we just mount the slide. Okay, sorry. Okay, it doesn't want to play. It just mounts the slide and then it marks the areas red. Another example, this one is the mitotic count. Again, you have all heard or know that mitosis is a really big deal for us as pathologists, help sometimes in diagnoses or in risk stratification. And again, it's something that it has inter-observer variability when it comes to mitotic count. This is another example and another solution where we just mount the slide and we press analyze, and as you can see, the solution just marks the mitotic figures and gives the count, as you can see, in a very super fast manner. Another example for the Ki67, the Key 67, I believe hematologists know what Key 67 is to them. That's a proliferation index. Again, we give the region of interest to the solution and we just say analyze, and as you can see, the application can mark the areas with a positive staining, the brown one, and give us the proliferation index of the tumor. That's another solution for the Ki. Just wanted to show you how things show. Did it do the play? Okay. Yes, this is for breast core tissue biopsies actually, but I wanted to show you how do things work. As you can see on the right side panel, you can choose the area that marks the tissue, the area that marks the non-neoplastic tissue, the area that marks the tumor, and then you can choose the Ki67 analysis, and it gives you the proposed percentage. As you can see here, it's 33.3. Most important of which is that it gives you the choice to accept or decline this. I just want to focus on this because AI is not replacing the pathologists or not replacing the clinicians. It's rather a clinical decision support system, so you will have or the pathologist to confirm or to decline this, okay? Another nice example, maybe we're not so familiar with nowadays, but I believe it's gonna be a shooting one in the coming days, is the spatial phenotypic signature with multiplex imaging. This is based on the idea that the tissue is stained with a number of panels. We all know lymphomas, you get the report and you have the CD10 and the CD20 and the CD3 and the BCL2 and the BCL6 and the MUM1 and lots of markers. In this technology, it incorporates the images in the multiple stains to show you the relationship between the different cells and the different clonalities, the relation between the neoplastic cells and the tumor microenvironment in a very nice fashion. Okay. Another example is the application of the CBC analyzers. Who doesn't see CBC results every day? Again, the CBC testing by integrating digital pathology and AI has led to the early detection, reduce error, saving time, support high throughput testing, and they say that it's enabling over 1 million diagnostic tests per hour worldwide. That's pretty huge, but most importantly, triaging conditions like sepsis. Then we go to another example, which is the AI application in the bone marrow aspirate. As you can see, the system automatically generates the diagnostic opinions based on the AI nucleated cell differentiation results and suggests the most probable diagnosis, as you can see. Pretty interesting. Okay, I just want to tell you that there are ongoing publications in research. At those commercial points, the publications do not, and research do not stop. They're still doing lots and lots in the field of the bone marrow aspirates and the bone marrow terrifying and training their models. We come to the second example or application, which is the application of AI in the flow cytometry. Again, the AI in flow cytometry has improved a lot in the automated gating in the pattern discovery and analyzing all the CD markers in the sample in a super fast way. Okay, we go to the chromosome banding analysis technique. Who doesn't demand this again? Now, this is one of the AI solutions that do the segmentation and the classification of the metaphase chromosomes in an automated way, and again, in a super fast way. I have learned today how the BCR-ABL gene fusion means a lot to you. So if we're talking about chromosome band analysis in Philadelphia chromosome, then another ongoing studies as regards the PCR, the fish, and even the NGS, which is a main concern for you to do AI application in the BCR-ABL gene fusion technology, okay, detection. Okay, what about the molecular genetics? Molecular genetics actually is the main concern in the precision medicine era and oncology era, which helps us mainly predict the prognosis and do the risk stratification for the patients and see what medications can be, okay? So the NGS, as it's the trendy solution now by oncologists, not only hemato-oncologists, again, is something that is mounted on AI, and the AI enables the integration of multi-omics like genomics and transcriptomics to provide a comprehensive view of biological systems. How is this feasible? It is by the idea that it can integrate dozens of variables from the NGS data like gene mutations, mutational burden, and clone stratification with clinical factors to provide personalized risk score. It also points out to druggable mutations and gives idea and recommendations for precision medicine and what medications are to provide are to give the best results. Okay, let's move because we're running out of time. Then we go to radiology and imaging. As I told you, radiology is the specialty that has been leading in the AI application, starting from appointment scheduling and up to producing a structured report, a full report of radiology. I chose today an example to show you, which is the LARS, the Lymphoma Artificial Reader System. This is a PET-CT classification model developed by the researchers. As you can see here, in this model, they taught the CT AI solution to point out to the areas that with the highest suspicion to lymphomas, not only the avid areas, but the areas that are really suspicious for lymphomas. These are the positive cases, and these are the negative cases, as you can see. Okay, radiology also has shown some other examples, like as you can see, these are chest x-rays where the AI solution can detect the lung nodules and point out to it, describe it. There are other CT chest examples that can point out the nodules, give you differential diagnosis, as you can see. Other ones for urgent cases and for triaging and emergency physicians. Then we come to the radiotherapy. If your patients receive any radiotherapy, then you definitely know what is contouring. Now this is again AI auto-contouring that can mark the organs that are supposed to receive the radiotherapy and the other organs that are supposed to avoid the radiotherapy. What about the management? Yes, for sure AI management has a very big impact, whether in providing predictive models, prognostic models, or in the field of the drug discovery. And as you can see, there are multiple publications talking about prognostic models in myeloid leukemias, in myelofibrosis, multiple myelomas, and lymphomas. Okay, giving the idea of overall survival predictions and progression-free survival predictions. What are the medications that are predictive analysis that are supposed to produce most response to these medications? The CAR-T therapy, the immunotherapy for the lymphoma patients, and lots of these using pathological data or even radiological data. Okay, then finally we come to the clinical decision support system. These are support systems that provide ideas about how are we we going to diagnose the patients and what is the best management for these patients. I want to show you a quick example, which is a clinical AI. This is the product of Elsevier. I believe you all know Elsevier. I've heard today like astonishing number of publications, 500 publications and lots of things, okay? So this one, you just go and type in your inquiry and it gives you the recommendations according to the guidelines and to the publications on this database. Okay, very nice. So what are the challenges that we are expecting to face while applying the AI? Actually, lots of challenges, starting with the high initial cost and the idea that the return of interest is not immediate. You'll definitely face technical challenges that require regulatory requirements of the approvals, the training and the expertise and resistance. And yes, you will definitely face some resistance from the staff. I promise you, we will not only find the enthusiasts, but you will find the uncertains and the skeptics. Now, as we come to the end of the presentation, this is the question that we all ask all the time. Will AI replace physicians soon? Are we at a real risk at the AI age? And the answer is no, because what I have shown you is all considered as a narrow AI. And in order to replace a doctor, you need an infinite number of algorithms, actually. So AI is not replacing doctors, it's rather empowering them. And now I come to the end of my presentation, and I invite you to visit my social media platform for providing pathology educational material for professional pathologists and clinicians interested in pathology. Thank you so much for your attention. My pleasure to have been here. Thank you.